Hello, I'm very pleased to be presenting Rural North West Health's 2016 to 2020 Strategic Plan. The development of the plan included reviewing what we achieved with the 2011 to 2015 Strategic Plan. Over the last 5 years, we have worked together and implemented change across all departments and all 3 campuses.
Staff and client satisfaction surveys are high and they're on a positive incline. As a board member and a community member, I can feel the positive approach as I walk through Rural North West Health. I see staff at all levels who are committed and they tell me it's a great place to work. We have a committed team, and the main thing about that is they have a client focus and a desire to change and be innovative, and I think it's this cleavage to that attitude that has assisted us to become the best small rural health service in Victoria.
When I started on the board 6 years ago, there was a real evidence of a culture that wasn't functioning particularly effectively, and over the time, with lots of opportunities for leadership and for professional development, I can notice a significant change in staff culture.
I think, putting my finance hat on, that our financial record over the last more than 5 years, nearly over the last decade, where we've achieved annual surpluses each year for at least the last 8 years. I think that is our greatest achievement because it gives you the opportunity to be flexible, it gives you the opportunity to take advantage of opportunities that come your way as an organisation. It means you can move very quickly, and I think having that financial viability has given us the strength to be able to increase our range of services for the organisation, and I think that's a great benefit.
The greatest achievement in over the last strategic plan has been the implementation of the ABLE model, not just because of the change that it's made in the lives of people who require memory support, but for the fact that it's been the catalyst for major cultural change throughout the organisation.
We've made great partnerships with other organisations, La Trobe University, and great things have come out of that with regard to the CARD group, and invaluable groups have been formed and lots of information has been learnt from those.
The strategic plan was developed in consultation with our team members, our partners and our community members. The Board of Management and Executive team worked with Foresight Lane to understand the health needs and use of health services of our community members and the complexity of the changing health platform where we work.
A strategic plan sets the direction for the organisation for the coming period of time. A lot of thought and planning goes into that to meet government regulations, government directions, government proposals, and matching those with perceived community needs.
The strategic plan offers future planning and therefore excitement, hope and a vision of the way forward.
I think having a strategic plan in place is so important. Firstly, you've got to have one, but secondly, it actually gives context to a lot of the decisions that are made by management. So it's one thing to have a strategic plan, but it's really important to convey that plan and make sure your team members and your community are aware of it, because that gives them some sort of understanding of where the organisation's heading. So I think that way they'll have a greater understanding of the decisions that are made and the way that resources are allocated throughout the organisation.
Well, I think the strategic plan really is a vision of an agreed strategy to move the organisation forward over the next 5 years. We allocate resources and decisions are made to achieve the strategy in relation to what the community expects of us, and the community now becomes part of the team as we move forward with a plan which has been developed within the community and agreed to by the community.
A strategic plan is very important for team members because they're the people that we want and we need to implement the strategic plan. And if they've got no idea about what's involved in it or being part of it, then it's not going to work.
Our strategic plan lets everybody know where we're going and holds us as a board and a CEO to account to getting a result.
We've decided that there are two key areas that rural North West Health needs to focus on with this strategic plan. The first one is that we need to continue to build on the business's capability. We will continue to focus on improving our financial results, the culture that exists at rural North West Health and how our team members feel valued and are engaged, and our clinical governance and ensuring that we provide safe and high quality health services to our community members.
The challenge for rural health organisations is to maintain viability, to keep our doors open, to use the resources we have to meet the community needs. For rural North West Health, our biggest enterprise is aged care, and that is a challenging commitment to maintain the services required in a community.
RNH will be a great resource for our community. We'll be a hub for people seeking advice and wellness and care for people at home.
Our team members are our biggest asset, and in 2016 to 2020, for us to have success with our strategic plan, our team members will display the following behaviours and attitudes.
Our team members at RNH will be open-minded and caring towards our patients, but most of all, they'll be committed and competent in their jobs.
So we need to be open-minded, we need to be willing to make changes, we need to be hardworking, and we need to be dedicated to the job that we're doing. And we also need to be able to think outside the square, so be willing to change and be innovative.
The FISH principles, which are having fun, being there, choosing your attitude and making someone's day.
And the key thing that the board wish us to work on is to respond bravely and innovatively to opportunities to improve the local health outcomes of our community members. Outcomes will be measured, achievable and brave and innovative.
Long-term change is what's required for the whole entire community, and that's a really difficult thing to do.
It's no longer just okay for us to carry on with the tried and true methods that we've already used. We need to change the way we think and become brave to produce new opportunities for those people in the community and to move forward to a healthy future for Warracknabeal and Hopetoun and all the services in North West Health.
We need to be brave and innovative so that we can provide the community with strength and clear direction in a time of massive change within the healthcare system.
We can continue to lead the way, meet community needs, take risks, challenge each other and explore new learnings.
One key outcome that we must achieve with this new plan is that we will improve local health outcomes and the health and well-being of all our community members. We will deliver services as close to home as possible, and we will connect community members seamlessly to other health services across the region and in metropolitan Melbourne. Our residents who live with us in Yarriambeck Lodge and in the Hopetoun campus will be able to live a good life, and that will be a focus of the strategic plan.
We're focusing on keeping people well and in their homes for longer. People want to stay at home in an environment that they're comfortable, so as a health service, we're focused on providing them with the needs and resources they need to be able to stay at home longer.
RNH will focus on wellness for the whole of the community so that our members will choose healthy lifestyle options, and in the end that will reduce the burden of chronic disease.
We want to keep people well, independent and living at home as long as possible, no matter where they choose to live.
Happy clients.
This strategic plan is innovative and brave and has set many targets for us to achieve. We know we will achieve them, and we look forward to working with you through change to provide innovative rural health services.
We are